Every female periods are different. Some happen like clockwork and another very unpredictable. One of the biggest misconceptions is that your menstrual cycle should be 28 days long. Well, actually, the normal menstrual cycle is between 21 and 35 days. And as you can see, 28 is just an average number. And actually, the normal length of your menstrual cycle is something that depends on when you first had your periods, like when you had your first periods in life. First of all, we should remember that having irregular cycles is normal in the first year post-menarche. Menarche is the first menstruation in girl's life. Okay, if you more than 1 year and less than 3 years post-menarche, it's okay for you to have cycles between 21 and 45 days. If you are more than 3 years post-menarche and to perimenopause, irregular cycles is when your cycle is less than 21 or longer than 35 days, or you have less than 8 cycles per year. For those who more than 1 year post-menarche, irregular is when they have longer than 19 days for any one cycle. Well, I have noticed that many females don't know how to count the length of menstrual cycle, so let's talk a little bit about it. You should count the length of menstrual cycle between first day of your previous menstrual cycle and first day of your next menstrual cycle. And first day of menstrual cycle is the first day of full flow. The next very common misconception is that you should have your periods at the same time every month. Let me explain what I mean. For example, you have your periods every 27 days, but this time you have your periods at the 29th day, and you think that something's wrong, that you have a regular menstrual cycle, but actually it's absolutely okay. The length of your menstrual cycle might vary a little from month to month. Like your cycle might be 2 or 3 days earlier or later, and it's absolutely okay. There are two medical terms for irregular periods, which is oligomenorrhea and amenorrhea. Oligomenorrhea is when your cycle is longer than 35 days long. And we're talking about amenorrhea when you don't have your periods for 3 months if before your periods were regular. But if you have a history of oligomenorrhea, we're talking about amenorrhea when you don't have your periods for 6 months. Amenorrhea might be primary and secondary. Primary amenorrhea is when you don't have your periods by the age of 13 and you have an absence of secondary sexual characteristics. Or if you have a normal secondary sexual characteristics but you don't have your periods by the age of 15. And secondary amenorrhea is when you don't have your periods after menarche. Menarche is the first menstruation in girl's life. Amenorrhea is not always a sign of a pathology. There's also a physiological amenorrhea, and it occurs if a female is pregnant, if she's breastfeeding, or post-menopause. Well, in this video, I want to share with you the most common reasons and causes of irregular menstrual cycles, and most common means that I see them more often in my practice. And the first one will be hormonal contraceptive pills and intrauterine devices. Menstruation is when endometrium sheds and exits the body through the cervix. And when you take in hormonal contraception, your endometrium, your inner uterine lining, become thin. And so there is less material to shed, and your periods might become lighter, they might become shorter, and then they might stop. But don't worry, because when you stop to use these methods of contraception, your periods will be just the same as they used to be. Also, hormonal intrauterine devices may inhibit the ovulation. It also may lead to irregular and longer cycles. And remember that if you take in oral contraceptive pills and you have missed even one pill, you're at risk of pregnancy. So if you don't have your periods and if you have missed your pill, you need to take a pregnancy test. If you're taking oral contraceptive pills and don't have your periods, that's maybe because your pill schedule is delaying or preventing periods. Usually it's when you don't take inactive pills and start a new pack right away. The next reason is polycystic ovary syndrome, or PCOS. And PCOS is a hormonal disorder which females have during reproductive years, and still we don't know what causing PCOS. And one of the diagnostic criteria for PCOS is irregular menstruations and anovulation. And usually patients with PCOS have their cycles irregular up from menarche. And as soon as they don't have regular ovulation or they have anovulation, they might be infertile or subfertile, which means that it takes them more time to get pregnant than for females who don't have PCOS. Stress, excessive physical activity, low body mass index might lead to hypothalamic amenorrhea. That means that earlier mentioned factors blocking secretion of gonadotropin releasing factor in your brain in hypothalamus, and it leads to abnormal secretion of LH and FSH, and it's also reduced estrogen level and leads to anovulation. And of course, it also leads to a low level of progesterone. Okay, to tell a long story short, stress, physical activity, and low body mass index lead to hormonal imbalance and anovulation. Also, irregular cycles are common in females with a thyroid disorder or high prolactin level. Well, it would be nice to know if you ever experienced irregular cycles and what was the reason for that. Please share your story in the comments down below. Thanks for watching this video. I can't wait to see you soon in my next one. Bye.